Another day with your fertility specialist. Um, please, I hope you're all having a nice day. If you have, family members who are not yet tuned into our live show, please do well to send them this link. On today's session, we are going to be answering all the questions that you have, as much questions as we can answer, though, given the time we have, that you have regarding your fertility status or your fertility journey or fertility things in general. So please do well to send someone data, send someone this link. Also, thank you to everyone who constantly likes our posts, shares our posts, engage our posts. We thank you, we see you all, and we deeply appreciate every single one of you. So to answer all our questions today, we have with us
Some of
Dr.
the
Kenneth.
questions, you mean?
Okay, some of the questions, because if we answer all, we will not live here today. So we have with us Dr. Kenneth Aguda. It's always nice to have you here with us, sir.
Yes, thank you. And hope we do justice to the questions
I hope so
themselves.
too.
All right.
So we're going to be having different questions. We have, medical questions, and we have some, let's say, non-medical questions, but we'll try to answer all of them as much as we can.
That's great.
All right.
Let the
So,
game begin.
okay. So please do well to drop your questions. We will definitely attend to them given the time we have. And if we're not able to attend to them on today's session, please do well to tune into our other sessions, because in one of those sessions we will attend to your questions. Okay, so to start, so someone is asking, how do I improve my egg quality if I want to conceive with my own eggs and the person is advanced age?
Oh, wow. Advanced age and improvement of health qualities. You know, it's a it's a very gray area, and you find out a lot of women coming for fertility care with this very advanced age, and then you tell them that the chances are poor with advanced age and egg quality. And the first question is, but can't we boost
Can't we boost the
these eggs,
eggs?
or can't we improve the egg quality? Now, it's a very sensitive question. And from those of us who are operating from the scientific and human biological condition, when a woman is advanced in age, the egg quality cannot be improved,
Okay.
because the egg quality to a large the age of the woman.
Oh, wow.
So the younger a woman is, the better her egg qualities. The older she gets, the lower her egg quality. So it's a function of age.
Mm.
In as much as there is no medication you give a woman to reduce her age, there is no medication to give her to improve or boost her eggs.
Okay.
Now, there's a problem with talking about egg quality. There are some medical conditions that reduce egg qualities. You understand? If those medical conditions are hit upon or are treated or cared for, then the egg qualities can improve. But egg qualities as a result of advancing age cannot be improved.
So, what are some of these
Medical
medical
conditions.
conditions
You
that
have
could
that diabetes
affect?
mellitus.
Okay.
Abnormal sugars reduce the egg quality.
Mm.
Thyroid abnormalities, that's thyroid, they affect the process of egg development and reduce the egg quality. And other metabolic conditions, for instance. So when you treat these conditions, and they could help improve the egg qualities. But age-related egg qualities, can't be improved with medications. So it can't be improved. Otherwise, a woman can get old and you say you're giving medications for the egg. What? The eggs are there from the day she was born, you know, and then it ages as she's aging. Like, for instance, there's what we call um, apoptosis index of the eggs of the ovaries. It's like a programmed cell deterioration
Okay.
or cell death. It gets worse as a woman advances in age. And there's no medication to reduce it. Just all about age factor. So it's just what it is. So just giving a woman who is like 45 years old medication to improve her health quality is just yeah. That's not to say that they cannot have eggs pregnant at that age. But the chances of having abnormal babies at that age is very high. So when she's old, advancing age, air qualities can't be improved. It's just what it is. But if it's as a result of disease conditions, if you treat the disease conditions, you could create healthy conditions or environment for the egg to develop, in which case the egg qualities could get improved or better.
Mm.
But because of age,
Aging is a disease. Oh.
disease, you rightly say, because with the future, probably 2045, that aging will be classified as a disease because there's nothing good about aging. Aging, your sperms get bad. You may still be able to have babies, but the
The
quality of the
quality of
babies
babies
may be
too.
lower because chances of having syndromic babies because of sperm abnormality is high. Chances of having miscarriages are also high because of abnormal sperms as men are aging. Chances of having babies with are higher because of aging sperms. There's nothing. Then about the eggs, problems also. Then even
Mm.
physical diabetes, hypertension, arthritis, heart
Arthritis.
failures, bone problems, dementia, Alzheimer's disease, all of that are age related problems. So aging is actually the biggest disease.
No wonder that artist said, "I want to live forever young."
That's one of my best.
He knew what he was
You
saying.
know, that song wasn't just a normal song.
Mm.
At some point in time, nature or the universe make people say things they actually don't even understand. And I took that kind of song. That song is just to tell us that we're getting to a future where aging can be controlled. And right now we're in that future. And we're looking at very soon people will have the options to live young for a very long time. And so it was a song 20 years back, but it's becoming a reality. I want to forever young.
I
I want
wanna
to live
live
forever
forever
young.
young.
Yeah, so at that point, life becomes more interesting. Then it's not just about the youthfulness. When humans achieve the ability to live young for a very long time, diseases like cancer, hypertension, diabetes, metabolic syndromes, and all arthritis,
Mm.
hypertension, all automatically
I
get reduced
reduced
or even controlled. So if you think humans are healthy now, wait
until we enter
until
that
we get that
future.
state. That is how you see how healthy humans can be. Then you can imagine a man that's 80 years and still having the strength of a 40-year-old man. That's beauty. How did you take us here? That was a tempting question.
All right. So let's digress a bit. So someone is asking if I have HIV, can I do IVF?
Yes, if you have an HIV, you could do IVF. You can do IVF. Yeah, actually, HIV is one of the indications for IVF, in which case you're trying to look at how to prevent
The
transmission of the
transmission.
HIV,
Yeah.
either to one of the partners or to the baby. And now there is a procedure of sperm washing.
Okay.
Sperm washing. I'm talking about scientific sperm washing before IVF or
Mm.
before intrauterine insemination. You
Okay.
do a sperm wash and you test the sperm that is going to be used for the IVF process for HIV viruses before you use them for the process of IVF.
Mm.
That way you reduce the rate of infection to almost zero.
Oh wow.
You understand? If you're using sperm of a HIV positive man
Mm.
or even the eggs of a HIV positive
Okay, so they
woman,
do
just
egg washing too.
in case you want to do surrogacy,
Okay.
and then you're carrying that kind of stuff. So
Okay.
yes, you can take care of you can prepare them in a way that the fluids around them becomes cleared of HIV virus. We do that in ALPS hospitals, and diagnosis. When you have HIV positive man using his sperms on the egg of his wife, and his wife is going to carry the pregnancy. So
Mm.
it is special procedure of sperm washing. So we do that in conjunction with organizations that have molecular laboratories and all
Okay.
of that. So we wash, prepare the sperm to the point that there are HIV virus in the seminar in the sperms to be used. So
Mm.
yes, it is one of the reasons why why IVFs can be. We had a guy Chinese guy who
Mm.
attended the of CRISPR,
Mm.
and then he returned and he made babies, babies for HIV couples. He made through IVF that can't be, even if for any reason get contaminated or injected with the HIV virus itself. That's a higher level of IVF with gene editing or gene modification.
Mm.
So yes, you could use IVF and advanced modalities of IVF to prevent HIV transmission.
But what if it's the mother has the HIV and she's carrying the pregnancy?
Yes, if she's carrying the pregnancy, now there are things that can be done in that case. First
Mm.
of all, you have to make sure that she is on HIV medication to
Okay.
reduce the risk of transferring the HIV virus to the
To the
to the
fetus.
babies. We call that vertical transmission.
Okay.
Yeah, vertical transmission of HIV, mother to child transmission of HIV. So you can prevent that. So you do the viral load and make sure the viral load is undetectable. And she's on medication while the treatment before the treatment and while the treatment is going on. Then at delivery, there are different modalities or practices you could put in place, to prevent the babies from having the direct contact with the maternal fluid,
Mm.
using of chlorhexidine, vaginal washing during process of delivering,
Okay.
and you don't break the waters so quickly when she's in labor and all of
Mm.
that. And of course, commencing the baby on preventive medications for HIV as soon as the baby is delivered. So yes, so there's just ways to go about it. So we see that all the time, and it's part of the things we practice.
Mm.
Yeah.
So if you're infected with HIV, sorry, that's just I have hepatitis
Yeah, the
too.
same thing. Just the
Mm.
way I explained with HIV,
Okay.
hepatitis, and in this case now, you plan the delivery, and when the babies are delivered, there are immunoglobulin medications that they take to reduce their risk of being infected with hepatitis. So that
Okay.
goes for hepatitis too.
Okay. All right. I was going to ask a question, but somehow it has misplaced in my head. So, for those that are out there having these viruses, you can see that child conception is not out of your reach.
Oh yeah.
You can reach out to us. We can help you to have a healthy child because, of course, you have to care about the health of the child that you are going to bring into this world.
Mhm.
So let's go to our next question. Someone is asking, what's the um let's say percentage of the possibility, I'm trying to remember the English of PGT, the success rate, yes, of PGT. How guaranteed is it?
Now, what PGT guarantees for you is to have the selection of healthy embryos, or if it's disease conditions that you are trying to avoid, it gives you 100% chance to avoid that disease.
Mm.
But when it gets to becoming pregnant following PGD, a whole lot affects pregnancy, the health of the mother, the health of the uterine lining, the and other metabolic condition that the mother may be going through can affect pregnancy. But what
Mm.
PGD does for you, PGD is a pre-implantation genetic diagnosis. It helps you in selecting the healthiest of the babies,
Okay.
then the right gender or the right disease to be avoided and all of that. So PGD guarantee 100% or 99.999% avoidance of abnormalities in the babies. And PGD will give answers to why pregnancy do not happen, because
Mm.
most failed IVF pregnancy are because of abnormalities with the embryos, and that
Okay.
is abnormalities with eggs and sperms, or eggs or sperms.
Mm.
So PGD guarantees 100% assurance on selection of the baby, but it doesn't guarantee pregnancy,
Mm.
because it's a lot that has to do with getting pregnant, which is outside PGD.
Mm.
PGD is not done on the womb of the woman. The womb of the woman may be
Maybe
problematic, can have adhesions, could have scars, you
fiber.
know, really affect following assisted reproduction technology.
Of fibroids, someone's asking if I have fibroids, can I also do IVF?
Now it depends. If I want to answer like the traditional gynecologist would answer, I would say yes. If you have fibroids, you could do an IVF, but
Mm.
then it has to be dependent on the location and the size of the fibroid.
Mm.
If you have a fibroid, like we see in Africa, for instance, that is getting to the chest of the woman or
Mm.
growing above the umbilicus, umbilicus is belly button, you know, you have no reason to do IVF with that fibroid. That fibroid should be taken out, But then if I have to answer like the professional that I am, an intrauterine surgeon and an IVF specialist, no matter how small a fibroid is, you should treat the fibroid based on its merit. Fibroids generally affect the rate of implantation. One,
Mm.
because they may not be even on the lining of the womb, but they release chemicals that negatively affect pregnancy,
Mm.
affect the contractility of the lining of the womb. An abnormal movement of the lining of the womb, which could be caused by fibroid, can make an implantation to fail. So when we see fibroid, we interpret the importance of the fibroid differently based on our gynecological orientation. Those of us who are reproductive gynecologists think about fibroid differently, but the conventional gynecologists think about fibroid in a very traditional way. They could tolerate fibroid. I'm not saying women don't get pregnant with fibroid. I've seen a lot with
Mm.
fibroids. Got pregnant. We were afraid they were pregnant. We were worried they were pregnant, but they don't care. And they delivered safely. So, but then if you have to make the woman pregnant, you have to factor all of these things because if you do an IVF on a fibroid and it fails, then you are forced to go remove the fibroid. So why don't you remove it before you start
Before
in
you
the first
start.
place? So it's neither here or there questions, but our thoughts on fibroid differ based on our gynecological orientation.
And once people hear fibroid, they just
Oh
have this fear
yeah,
in their hearts
yeah.
about the whole
Yes,
thing.
usually women, once women hear fibroid, I mean African women hear fibroid, it's
It's like a
like a
sentence.
sentence. But fibroid is normal. You just address it as quickly as possible. It's a genetic condition that comes upon you because you are a Negro. You are an African. You're of the African descent, of the black descent. Often, so we
Mm.
have it more than the Caucasians. So, and once you are, and these days we see fibroid in a very young age people.
Mm.
And that's to say the lifestyle we have as young people too is encouraging the manifestation of the genes of fibroid, and then we develop this fibroid quickly. We've had to operate 21-year-old girls with
21.
21-year-old girls with fibroids, and
That's
not
so
just small
young.
fibroids, unmarried yet, with huge fibroid that is compromising the quality of their life, making them anemic all the time.
Oh,
So if you
God.
have fibroids like that, no matter how young you are, it should be addressed. So, but the best thing, if the fibroids are a little bit big and are close to the lining of the womb for public education reason, they should be taken care of before IVF is done. But if you get pregnant with it continuously, well, fine, you'll be monitored. I know fibroids can make pregnancy journey be very
Hectic.
troublesome. You
Mm.
could have degeneration of fibroids, which could give a lot of pains and necessitates unnecessary admissions. You know, you could have miscarriage because of fibroid. You could have problems with labor because of fibroid. You could have premature delivery because of fibroid. Then the most scary one is that you could have abnormal bleeding after delivery because of fibroid. And in extreme cases, this fibroid may cause the uterus to be removed. So why do you want to have those risks to deal with in pregnancy when all of these could have been
Sorted
addressed
out.
before you get pregnant? I'm usually a little bit scared when I see fibroids during pregnancy. Because of my knowledge, I just get scared.
I hear people say, I have fibroid, but I had my baby. I had fibroid and I had my baby.
Yes, it doesn't mean
This.
when they have fibroid they can't have babies. They can have babies, but they are taking a risk. And you could take a risk and get away with the risk, but that doesn't make it normal. You
Doesn't
know
mean the next person will get away with it
exactly.
too.
We have seen people with fibroid who don't survive it with pregnancy. So we're scared when we see big fibroids and pregnant. Sometimes the fibroids choke up the womb and doesn't give space for the baby to grow and express his or herself in the uterine cavity. So fibroids are different. Some come with symptoms, some without symptoms. And by the way, we're not talking about fibroid. I'm getting carried away.
Okay, sorry about that. So please let's do well to drop our questions. Any question that you have, we'll try to address it before our time runs out. So someone's asking medical conditions that require a surrogate.
Surrogacy. You know what? The rate of surrogacy demand that women demand for surrogacy these days is extremely high. And to be very candid, I'm a little bit worried.
Why is that?
Yeah, because I'm just worried. I don't know why I'm worried about that. Yeah, because just come to the organization and all they want is surrogacy. See, the world is
Mm,
changing and the social dynamics of the world is changing. Oh, you asked about medical condition, but let me first of all talk about the non-medical conditions. These days, you have people who are so busy with their profession and then don't have time to settle to carry pregnancy for themselves. So they come for surrogacy. So this is surrogacy for social reasons. Then
mm,
you have a lot of people in show business and will not want pregnancy to interfere
with
with their
their
physique.
lives.
They come for surrogacy. They're not sick. They could carry pregnancy. They come for surrogacy. So these are good reasons for surrogacy. But then we have genuine, I mean, medical reasons now, which is what you asked
Mm,
for surrogacy. One good medical reason it could be heart conditions, heart
okay.
failure. Women with heart failure and they still have eggs, but then pregnancy can jeopardize their quality of life and can cost their life. So it's a good reason to have surrogacy. Then you have those with let me use the word in a colloquial way, damaged wombs. There are wombs that have been battered by gynecological procedures, scars in the womb that are not amenable to all kinds of rejuvenation, hysteroscopy, and correction. And then they have recurrent pregnancy losses or recurrent implantation failure. It is an indication for surrogacy because how many times would you want to lose a pregnancy or want to have failure because you before you accept that. So these are some of the reasons why you could have a surrogacy. Then you have cancer people, some people with cancer, and then they have eggs. And you know
Okay.
that some of these cancers can be sensitive to estrogen or progesterone.
Okay.
That's to say, estrogen can make them grow worse,
Okay.
or progesterone make them grow worse, like breast cancer, for instance. And these
Okay.
days, breast cancer affects even young girls, even in the ages of 20s. We see quite a number of them. My friends who are general surgeons and some of the guys with some of the patients we see have all these cancers, and then you don't want to just get pregnant because of unnecessary exposure of your cancer to estrogen. But you have eggs, good eggs. So you could be stimulated in the most healthiest way, minimal stimulation or natural cycle IVF, and the eggs are taken and get some other persons to carry the pregnancy. So there are a lot of reasons. Some could be metabolic disease, diabetes mellitus that has been difficult to control. You could have somebody carry pregnancy for you. So you have the medical reason, then you have the social reasons. So and the social reasons are becoming higher these days, as we see in the clinic. So all of this happen. So whichever situation it is, the world is getting too modified,
Mm,
and people should be treated for what they want.
okay.
But it's good to mention that in some places in the world, no matter your reasons, surrogacy is not accepted. But in a lot of other places in the world, surrogacy is accepted.
Okay, it's not accepted as part of their laws and
Yes, exactly.
regulations.
Like Italy, for instance, is not accepted. You can't do it in Italy, and you cannot do it as an Italian national living in another country and coming down to Italy to have your baby. It's not accepted. It's not accepted. So that's some reasons why surrogacies can't be done. For fashion reason and for health reasons.
Okay. So it shows this damaged womb of a thing. It shows that the gynecological world they need to undergo a reforming in a way because some of these things are from procedures that are done and then it ends up damaging the womb.
Yes, procedures like bad, like some very complicated uterine surgeries, like bad fibroid surgeries, for instance, that end up healing with adhesions can make the womb difficult to correct. Then you have conditions like adenomyosis. Adenomyosis can grow into the lining of the womb, affecting the lining of the womb that we call junctional layer. The
Mm,
junctional layer is the most functional part of the womb when it gets to conception. Anything that affects it can affect your chances of conception. So when adenomyosis infiltrates those regions, it becomes difficult to have implantation. So it's not necessarily gynecological procedures, but yes,
mm,
gynecological procedures could. D&C, for instance, which is a procedure that we're thinking should be outlawed,
mm,
because it is not a healthy procedure doing an evacuation, because you scrape off every part of the healthy uterus. As against doing hysteroscopy, what we're advising now is that when you want to do a termination of pregnancy, or when a woman has a missed abortion or a missed miscarriage, pregnancy just implants in a very small area
mm,
and not the entire womb.
mm.
So it's advisable that you use a hysteroscope
I'll
under
take
direct
note.
vision to just take it out from there. That way, the area involved is very small, and you do it under vision, and then it is safer for the woman. She could recover from that. But what the
Mm,
regular gynecologists do is uh, put a blind probe and scrape everywhere, including where the baby is attached. So you scrape the
both
the bad
healthy
place
and
and the healthy places.
oh,
So the whole uterus can heal, the lining of them can heal with scars and adhesion. Now, depending on how easy and how quick it is for some women to recover, they may not have any complications. But
mm,
some don't escape it. With only one evacuation, the whole uterus goes into adhesion. Getting her pregnant becomes a problem. So yes, some gynecological procedures could. And then some women don't just have one evacuation or D&C.
mm,
Some have five, some have 10. Yes, I've seen all of those. And some take out pregnancy advanced stage. And those times are usually times where complications could easily happen. So it's just what it is. So it's not necessarily gynecological procedures, but yes,
mm.
gynecological
It's
procedures could
serious.
predispose to having some of those stuff.
Oh. So let's talk a bit about rejuvenation. So someone's asking how many sessions of ovarian and endometrial rejuvenation do they need to undergo before their IVF, and how soon after these
Usually,
sessions
yes,
can they
usually,
start?
usually three, if they can
Hmm.
afford it, three, and then a month after the third one, 2, 3 months after the third one, you could go for an IVF.
Okay.
You understand? So ovarian rejuvenation, yeah, three ideal. Two, one, if that's what you can afford, it's still okay. Than not doing anything at all. So you could do that before going for an IVF. Yeah.
Okay, so we have Tessie asking if IUI can be done with a fibroid. We're back to fibroids.
And that's a tempting question. I saw a case like this just this morning. Are you with fibroid? Because I told her I'm not very happy with the fibroid. You know, I can tolerate it if the fibroids are not complicated fibroid. It's just like you're getting pregnant spontaneously. But of
Hmm.
course, I had to tell her that if she get pregnant with fibroid, the likelihood of having complications.
Hmm.
But there are chances that she could also be okay. Understand? And then decision is hers. It can't be done if she goes with it. But now it depends on the kind of fibroid too. If the
Hmm.
fibroids are very badly located and they are very big in size and all of that, you may want to advise her to take out the fibroid. So the answer is neither here nor there. But yes, you can do IUI with some degree of fibroids, but not every fibroid. So each fibroid should be analyzed and decision to be taken based on the merit of the fibroid. Some IUIs should be rejected when there are fibroids, and then some could be permitted when there are fibroids. But bottom line is, it depends on the the guideline of the country.
Hmm.
That accept or
Okay. So someone is also asking, um, what happens when you have good grade embryos and they don't implant? What could be the cause of having good embryos and they don't implant?
Now,
And
good.
everything was fine.
Yeah, you can never say everything is fine in reproductive medicine. If you have good grade of embryo and they don't
Mm,
implant, one you have to look at a whole lot of things. It means
mm,
that the conditions are not right. Let's start with the embryos. What's a good grade embryo? The fact that an embryo is blastocyst grade A or whatever is the best grade according to the region of the world
mm.
doesn't necessarily mean that the embryos have a normal genetic component.
Interesting.
So the embryo could look perfect. In fact, most of the field embryos to implant are good grade embryos. Blastocyst grade A, but yet they don't implant. Who they implant? The first thing is the genetic abnormalities. And you
Mm,
can never make diagnosis of genetic abnormalities. And that is why, except to do a pre-implantation genetic diagnosis, then you can know embryos that are
good.
really good grade and are euploid. You understand? So, good grade embryo classified by what criteria? So if it is, for instance, in Nigeria, or some part of Africa where PGD is not done for every embryo, you can never say this embryo is really genetically okay, because the greatest cause of failure of IVF is genetic abnormalities.
Mm,
Then after genetic abnormalities, you could have perfect embryos, and then the lining of the womb may not be all right. The window of implantation may be narrow because of hormonal anarchy, and then pregnancy may still not happen. So there are quite a number of things. There could be immunological problems. Maybe the woman have natural killer cells, has anti-cardiolipin antibodies,
mm,
and all of that going on in her system. These things can damage embryos, and then
mm.
no pregnancy happens. So uh, the person should be evaluated, and there is no limit to this evaluation. When pregnancy doesn't happen, there is always a reason why it doesn't happen. Yeah.
All right. So let me. This question is, I don't know how to ask it, but someone is asking though, if they use donor eggs, is this child their child or is it the child of the donor?
Hey, let me ask you that question. Whose child is it?
Is the Lord's child?
The Lord's
Is
child.
the Lord's child?
Then give it to the Lord. Oh yeah, I answer this question a lot of times. Okay, so and sometimes the question comes to me in a very uncomfortable state. Makes me very a little bit uncomfortable. Now, what happened before the donor egg? Documents, legal documents are signed.
Mm,
The donor signed not to have any claim to the baby, and you sign to accept the eggs. So legally speaking, you who signed, it becomes yours. You understand? Because there's a legal transfer
mm,
of a garment from one person to the other. And most cases, the transfer of the garment is done between anonymous parties. So you don't even know. So who do you want to throw the child to? So it's yours legally. And then let's look at genetics. Now, if you are the one who carries the pregnancy from a genetically, I mean, from a donated embryo, I mean, donated egg, for instance, during the process of pregnancy, a lot of scientific papers show that there's a transfer of gene material from you, the carrier, to the baby. That good number of your genetic qualities and characters and characteristics go to the baby. So even genetically, to a large extent, it becomes yours. You understand? Who carries the baby? So this question is always coming from the fact or from the point that humans are addicted to their gametes. Yeah, it's understandable. You want to
mm.
see yourself and all of that in an
Your mini
offspring
me.
and all of that. So, but who would you blame? You've gotten to a stage where there are no eggs. And then we have to ask ourselves when we get to making babies, what exactly is our need for making a baby? Is it to have the opportunity to parent a child, to be a parent to a child, or to have genetic connection with the child? These are two reasons why people can decide to get pregnant. They want to see themselves in someone and someone else, and some just want the opportunity to be a parent. And that is why they can adopt and still be parenting and show love. So these are not things that happen because we desire for them to happen. They are out of necessity. You understand? So the egg donation, it's a very big issue. The same thing goes with sperms. You know, it's just what it is. Unfortunately,
Okay.
yeah.
So after an embryo transfer, someone's asking what is the fate of their remaining embryos if they have leftover embryos?
They decide what happened. In our facility, for instance, you sign all your documents. If you have excess embryos, you tell what you want to do with the excess embryos. If you want them discarded, you sign for it to be discarded. You understand? So you take responsibility. We may discard, but we're not the one discarding. You are the one asking for it to be discarded.
Hmm.
And if you it can be frozen, you can have them donated to some other couples, and you can use them for whatever you want to use them for. You know. So, but this comes with moral obligations, and then you want to ask that some people feel that when you discard embryos, you're destroying lives. But I said no to that. Yeah,
Hmm.
embryos are not humans. They are not babies. They are potential for life. And that is why most embryos do not become babies because they don't have the capacity to become babies.
Hmm.
You understand? So it's not every embryo that has capacity to become babies. And then the morality is that no reproductive gynecologist or embryologist starts out to make embryos and discard embryos. So we don't judge ourselves as discarding embryos. It's the rationale, the morals behind it. When you're stimulating someone, you don't even know the number of eggs the individual will produce. And that is why in some society where this is a very big morale, you stimulate to produce few eggs, 2 to 3 eggs, you treat all
Hmm.
the 3 eggs and put all back in the uterine cavity. So nobody discards. So every society needs to sit down and make sense of this science and decide how he wants it. 2013-14, I was doing my small work in Italy. And of course, Italy is controlled by the Catholic faith. And then we have problems with embryos. Then we don't even freeze embryos because it's not acceptable in the faith that controls the Roma, I mean,
To freeze
yes,
embryos.
that controls the Italian world, And then the value, the belief was then embryos are life. Don't discard them. So you have to use all the embryos at the same time. Now we now went into the style of minimal stimulating IVF and the natural cycle IVF. Natural cycle, you just generate one egg, one embryo at best two. So you put back everything. All modalities of fertility care, which is based on what your concerns are. So with me now, you may be a Muslim. I know how to treat you as a Muslim. I know your faith, and I'll treat you without hurting your faith. You may be a Catholic. We'll treat you according to the Catholic faith. You may be a Rastafarian. We'll treat you according to Rasta. So you may be a Pentecostal or a Protestant, or we just treat you according to your faith. So at the end of the day, nobody is hurt. But we know what embryos are. Most embryos are not destined to become life. So why do you say that we are discarding life? Because we know there are embryos we see, and then I know
You
this
know,
one.
it's
Nothing good is going to come out of this. You know, even if you look at the human itself, how many eggs does a woman have? Woman is born with about 700,000 eggs, and she loses hundreds of them every month until they are finished. Who wastes them? Who is taking responsibility? The same thing with the sperms of men. Not all sperms are destined to make babies. More sperms are wasted than those that make babies. Nature is wasteful. And I guess that's why we're going to go to the point where we have to learn how to preserve nature. And I'm a lover of nature. And I've been working on how to make nature perfect, and which includes saving the human gametes.
Hmm.
Yeah, so please, it's a sensitive question you just asked, and it hits me in a very, yeah, in a moral point.
Okay.
Yeah.
So now this is Africa. We know we do
Mm.
not have good roads. So
Yes.
someone is asking, can traveling on a bad road after transfer
Uh,
affect their chances of pregnancy and
no, I actually
implantation?
would say no, because what makes for pregnancy goes beyond the road. It's genetics. I've seen a woman who we had an IVF and entered a lorry all the way from Abuja to Benin.
Hmm?
I'm talking of lorry, Nigerian kind of lorry. She came back with her baby to show us the baby. Nigerian roads are not good, we know. But what makes for pregnancy goes beyond traveling on good or bad road. There are
Hmm.
so many women who, after embryo transfer, sleep on a bed or lay in a bed for 14 good days without bathing, without applying cream or lotion on their body. They sit upstairs and never come down, and they never get pregnant. So, what makes for pregnancy is beyond physical activities. And in fact, it's advisable to move around after embryo transfer, because when you move around, there's increased blood supply to every part of your body, and that
Hmm.
encourage pregnancy to happen. Well, I'm not saying that you should go jumping on bad roads, doing all of that and all of that, but bad road doesn't necessarily cause a problem. Those days in Denmark, during some of our training, you just do an IVF, and then the girls just mount on their bike. Denmark drives, they ride a lot of bikes in Denmark, in the bicycle. I'm talking about not even
Hmm.
motorcycle, bicycle. It's a sign of health. That's a lovely orientation of a nation. Millionaires and billionaires riding bicycle. They mount on their bike and ride home. And they have one of the fantastic pregnancy rates. Yeah, the roads are fine. You understand? Not like the road in Nigeria, that the potholes are like a mini
Mini
rivers.
whales.
Maybe that should be fixed. May improve the quality of pregnancies we're having. But yeah, it doesn't necessarily affect. But we want them to style. But travel, you have to travel.
Actually,
Unfortunately, I don't
unfortunately.
know whether I've answered the question here anyway, but I just said something.
Question too. Your
Yeah, yeah,
question has
yeah.
been answered. So, how many? Someone's also asking, how many sessions of laser vaginal rejuvenation is okay for a lifetime?
Now, for an aging, okay, that's interesting. Now, it's recommended that after a woman have given birth, whether vaginal delivery or cesarean section delivery,
Mm.
abdominal delivery, she should have a session.
Mm.
Yes, because once you are pregnant, all the things that happen, whether you have a delivery through the vagina, have has an effect, a negative effect on the vagina.
And someone else asked if they have CS, do they need the same
Exactly.
rejuvenation?
You need one session after delivery. But when it is as a result of menopause, and then all the changes, weakness of the pelvic floor, laxity of the vaginal tone, and all of that, and even some level of stress urinary incontinence, painful intercourse, dryness of the vagina. You need three sessions, one monthly for the first 3 months, then
Mm.
after which one yearly. But then the frequency can also be modified and as directed by your clinical condition.
Mm.
Yeah, those are the frequency that is needed.
But then, if you need as many sessions as you want, as far as
The
it's healthy,
gynecologist would I
your
will
doctor will
advise on
speak to
that. Yeah.
you and advise you properly. And of course, here at Alps Hospital, we have wonderful gynecologists and wonderful doctors who would always give you the best choices available for your health. So, as we're rounding up, someone is asking about hydrosulfings. Yeah.
What's the question about
So the
hydrocephalus?
person said he had an ectopic pregnancy and he has been facing hydrosulfings. So what's the way out?
Yeah, the tube needs to be treated first before the next pregnancy. And the way to treat the tube is either to surgically remove the tube, either through laparoscopy or open surgery,
Mm.
or to clip the tube so that you block communication between the fallopian tube that have the poisonous or bad fluid and the uterine cavity. Or you could do hysteroscopy and occlude the fallopian tube through hysteroscopy if the ostium, that's the connection, can be seen through the uterine cavity. You
Okay.
could occlude it through that place so that the whole essence is to prevent fluid that had accumulated in the fallopian tube from dripping into the uterine cavity, because it could be poisonous and mechanically it can wash off or wash out a little pregnancy. So those are the things that should be done before the next attempt at pregnancy.
But isn't it just better to take it out since it's poisonous?
There are conditions. There are some surgeries that may be very difficult to do. If a woman has a frozen pelvis, for instance, reaching to the fallopian tube may be very, very
Mm.
interestingly difficult, whether by laparoscopy or open surgery. That way you can go hysteroscopically to block it. If it's easy to take it out, fine. Because it's disease already. It shouldn't be there. Shouldn't just be there. You know because it can be giving pains, chronic pelvic pain. So the best thing
Mm.
is to take it out. But if it can't be taken out, find a way to block the communication between the fallopian tube and the uterine cavity.
Mm. So someone is asking if they can conceive with just one fallopian tube.
Sure, with one fallopian tube, you can have 10 kids. And for those who want to have many.
For those who still have eggs, by the way.
Oh, yeah, for those who still have eggs. Yeah, because IVF, you don't need the fallopian tubes for
Mm.
IVF.
Mm.
Yeah, that's true.
All right. So someone's asking what are the causes of breast discharge? I feel we've answered this question, but let's just
Breast discharge.
yes, causes of breast discharge.
Okay, so hormone abnormalities could cause breast discharge. Like
Mm.
when you have elevated prolactin, serum prolactin, you could have breast discharge. When you have cancer of the breast or some soft benign growth in the breast, in the ductal area of the breast, you could have a breast discharge. Cancer of the breast can cause breast discharge. Then when you have some tumor in the brain, like in the pituitary gland, you have
Okay.
the adenomas, micro or macro adenomas. They help in secreting the hormones that make breast milk development, and then you could have all of that. So if a woman has breast discharge, don't just take the breast discharge at face value. You have to look for the reason. Some could be gentle reasons, and some could be very bad reasons. So you just have to look for what the exact reason is and treat it. Some breast discharge you may need to do a brain surgery to correct them. Yeah, while some just simple medications can take care of them.
Okay.
Stress can cause elevated prolactin,
Oh wow.
and excessive nipple stimulation or sucking can cause elevated prolactin. So whatever is the cause, treat the cause.
All right. So I think we've had enough questions for today. Thank you, Dr. Ken, for your time. We thank you for answering most of our questions. Please, if you still have questions, you can drop them in our comment section. We'll do well to attend to them on a later date. Thank you to all our viewers. Thank you to everyone who stayed with us till the end. Please, if you have someone who is in need of consultation or you know someone who is, going through fertility issues, I'm pretty sure by now you all know that Dr. Ken is one of the best. He's the best, actually, as far as we
No,
know, in this part
one
of,
of the best.
okay, one of the best in
Not the
this part,
best.
in this region of the world, of Nigeria as we know it. So please, I'm pretty sure we all care for people that are close to us. So do well to, direct them to us, and we'll make sure to give them the best care. If you want to book an online consultation, displayed on the screen, do well number, and your questions and whatever needs you have will be attended to. So thank you to all our viewers. We thank you all for giving us your time. I hope you all have a lovely day. Thank you.